Hi everyone. Thank you for watching us tonight. Before we start our session at 9 p.m., please like and share this live to others as we will gain a very valuable knowledge about knee pain from our guest speaker shortly. Not only that, you and your friends have chances to win our lucky draw. So just keep sharing. Don't miss these chances. Hi, we have Rogan Gun here. Hello. Okay, just like and share first our live session. We will start at 9 p.m. soon. Hi, Steffi. Glad to see you here. Please like and share. We have Wafi. Thank you. Like and share this live. Stand a chance to win our lucky draw too. Hi, Casey Tan in the house. Thank you for your kind support. Let's just like and share as much as you can. We will start shortly at 9 p.m. Thank you for your likes. Thank you for sharing. We want more in the house. Hi, Alicia. Okay, we are reaching 9 and it's 9 already. Thank you, everyone. I can see likes. I can see loves. Thank you. And some shares. Thank you. I'm Fazlin, your host for the topic of discussion tonight. Please stay tuned to the end of the session because we will have lucky draw for attractive gifts too. You may type your questions along the session in the comment below. We will try to answer the question after the talk. Okay? Are we good? Are we good? Can you please just respond me in your comment? Are we good? Are we ready for the next? Thank you, Andrew. So all the while, we have been hearing friends and family members complaining about knee pain. Even my mom complaining about her knee pain. So I believe so many of us might wonder, is knee pain curable? Will I suffer for the rest of my life? We are very honored tonight because I don't have the answer, but we have the expert to answer this for us. So let's welcome Dr. Izan Ibrahim from Al Specialist Kuala Lumpur. Assalamualaikum and hi Dr. Izan.
Waalaikumsalam. Good night. Good evening to you, Fazlin.
Yeah, thank you for being with us. Yeah, good. We are good, Doctor. So let me read a bit about Dr. Izan, our specialist tonight. Dr. Izan is a consultant orthopedic in Al Islam Hospital. He has graduated from UKM Hospital as specialist since 2015. His specialty is arthroscopic.
2005.
Oh, sorry, 2005. Yes, that's so young of you, doctor. I give some discount. Okay, his specialty is arthroscopic knee and ankle surgery with regards to cartilage problem. Let's look forward for Dr. Izan to share further on his experience in these knee pains. Pass to you, Dr. Izan.
Thank you, Fazlin. Assalamualaikum, everyone. Good evening. Thank you for inviting me for this talk to CMED Healthcare, especially. And thank you, everyone, for taking their time off to watch this live lecture on knee pain. Um, the reason why I choose this topic is because these questions have been asked to me in my clinic many times, and it's really quite reasonable to ask this. You know, once you have knee problem, you wonder whether you will have the knee pain forever, or is this just going to be a temporary thing, especially when you have people around you, your pachi, machi, aunties, uncles who've been suffering with knee pain, and you see them progress, uh, become worse with time. You wonder whether this the same thing will happen to you. And the answer really to these questions is actually depend on the cause of the knee pain. Of course, there are so many reasons, so many causes of knee pain, that this the thought of suffering for the rest of your life, or the thought of having to go for surgery, should not prevent you from seeking treatment. Because some of my patients, they come late because they are scared that they might have to go for surgery. So this talk actually is to make it clear that you should ask for treatment. You should seek treatment early, so that the problem can be solved earlier and surgery can actually be prevented. So the answer of the topic will depend on the cause of the knee pain. And actually, it's surprising that most of knee pain causes are curable if you seek early treatment and proper treatment are provided. In Malaysia now, the latest surgical innovations allow the knee joint to be saved if it's treated earlier, and prevent from undergoing a major surgery in the future. A good example of these type of surgeries are cartilage regenerations or cartilage resurfacing surgery that is now commonly done in Malaysia. Let me talk a bit about the many causes of knee pain, and we shall focus on the common ones first. As you have already heard quite a number of times, the name osteoarthritis is commonly mentioned when you talk about knee pain or joint pain. Osteoarthritis is actually a problem caused by deterioration or damage to the cartilage, and this is actually the cartilage that I'm talking about, or in Malay it's called tulang rawan. Or if you want to have a clearer picture of what a cartilage is, when you eat your KFC chicken, the end of the bone there is a shiny white glistening um, end of the bone. That is actually is our cartilage. And cartilage problem is actually one of the commonest causes of knee pain, and it can happen at an early age or at a later age, depending on the causes. If it occurs in a later age when you are older, it's called primary osteoarthritis. If it occurs earlier due to injuries like football or any kind of sports injuries, it's called secondary osteoarthritis. Another common causes of knee pain is inflammation, and this can be due to many reasons. Autoimmune diseases like rheumatoid arthritis, SLE, gout are common causes of inflammation of the knee, and also inflammation of the surrounding tissue in the knee. If it's occurring in the tendon, we call it tendonitis. If it's occurring in the bursa, it's called bursitis. Infection is also another common cause of knee pain. It can occur inside the knee joint or outside the knee joint. If it occurs outside the knee joint, it can easily be treated with antibiotics. Or if it's occurring at a much later stage, then maybe surgery can help to solve the problem. So, when we talk about knee pain, the causes can actually be divided into two broad categories. So, you can either divide knee pain as caused by the inside of the knee, occurring inside of the joint, or outside of the joint. So, the inside of the knee joint, you can have muscle injury, you can have ligament tears, you can have meniscus tears. Um, I will show an illustration of this tissue after this. Also, it can be due to plica syndrome. Uh, Problems that occurs outside of the knee joint, around the knee joint, can be due to ligaments and tendons. So, knee pain basically can be caused from the inside or from the outside. So, the inside can be due to cartilage, can be due to ligament like ACL. This is your ACL. Can be due to the meniscus. This is a picture of the meniscus, which is a tissue that is acting as a shock absorber between the two bones, the upper bones and the lower bones of your joint. So all these tissues or structures can cause knee pain. This is another picture of all the structures that may cause the knee pain. So how do doctors diagnose knee pain? So when you see a doctor, most of the time x-rays will be taken. This will give you a better idea of the bony structures inside the joint. It can give you idea about your joint space, whether it's narrowed or it's normal. If the doctor suspect inflammation or infection, they will do a blood test. Or if they suspect some fluid collection like abscess or pus, they can do an ultrasound investigation. Or the best method to see what is going on inside the joint or surrounding the joint is actually by taking an MRI. So we go on to talk about knee osteoarthritis, which is one of the commonest cause of knee pain, either in the old or in the young. Arthritis is basically any condition that is caused by problems with the cartilage. This is the cartilage, the tulang rawan in bahasa. Any injuries, tears, defects of the cartilage can lead to arthritis, osteoarthritis. So when doctors diagnose a patient with a cartilage problem, they will usually treat it with non-surgical um, treatment, like giving them medications, asking them to go for physiotherapy to strengthen the muscles, giving them a knee strap. And if all of these fails, maybe the next step is to give injections into the joint. And Sometimes the knee will become swollen, and if this occurs, then the doctor will have to aspirate the joint to get rid of the inflammatory fluid before giving an injection. And the commonest injection given for arthritis is hyaluronic acid. And the example of HA injection is either monovisc or single injections. If all the non-surgical treatment given to the patient with cartilage problem fails, then and if the pain become worse, it means that this pain or this problem can't be treated without surgical intervention. So the next step would be to go for surgery. And most of the time, this surgery will involve a very small incision, and the surgeon will put a camera into the joint to look directly into the joint to see the exact nature of the problem. And if the problem is encountered, the surgeon will treat it at the same time. A good example of cartilage problem that cannot be solved uh, via injection or non-surgery treatment is a cartilage defect, like what we see here in the picture. And if this problem we are now it is now available in our country to regenerate this defect, to grow back the cartilage and to prevent the knee from going into a full-blown osteoarthritis, which require a much more major surgery. As we can see in the slide here, this is a defect, a large hole in the cartilage of your knee joint. And the surgery that is appropriate for this problem is to cover this defect, cover this hole with a membrane called hyalofast to regenerate, to grow back the cartilage. A good example of how we should treat this is you can see on our road now a lot of potholes. And if these small potholes are being neglected, uh, as usually is the case in our country, then um, this small hole will soon become bigger. You know, every day lorries, cars go through it, use the road. This small hole can become big, and when it's bigger, it's more difficult to treat um, without costing a lot of money. The same goes with this kind of problem in the knee. A small hole can become big if it's not treated early. And when it is big, you can't treat it using a simple method anymore. It has to be a much more major surgery. So this is an example of how a cartilage can regrow with surgery. This is the hole which has been covered by halofast to regenerate a cartilage. This is the same knee a year later. This patient actually fell down a year later and suffers knee pain. Luckily enough, the injury did not affect the surgery that was done a year later, and um, it is nice to see that this hole that was here a year ago has been covered very nicely. This is another surgery to cover up a hole. You can see here there's quite a big hole there, and it has been resurfaced using an implant called biopoly. And this surgery is usually um, uh, selected for those patients who are not capable to regenerate their cartilage. For example, those who smokes, those who are on steroids, or those who have diabetes. They don't have the ability to regenerate cartilage. So the best surgery for them to cover the hole in the joint is by using an artificial cartilage. So by using this, you will prevent this hole from getting bigger and save you from having to go uh, um, this kind of surgery. So this, you can see here that this is a normal cartilage, and this is a cartilage that has been damaged. And if you let this go on without treatment, you can end up with an artificial joint made of metal and plastic. You can see the progression of arthritis from the x-rays as well. I've seen this a lot of times in the clinic, where patient come to me maybe 5 years or 10 years earlier, and they don't seek treatment. They run away after the first treatment because they are scared of injections or treatment, or even minor surgeries. Their knee will progress to become like this. And when it has reached this stage, the only solution is to replace the joint with an artificial joint. Okay, we have talked about the commonest causes of knee pain, which is cartilage problem causing arthritis. Um, Other common causes of knee pain are infection, like a knee abscess. For a knee abscess, the treatment can cure the problem. You just need to drain the abscess, remove the pus, then the problem will be solved. Uh, if a knee abscess occurs on the skin around the joint, but a septic arthritis will have the abscess inside the joint. And this uh, is a very important problem which need to be treated early, because if you keep it for a long time, it will damage the whole joint, and you will end up with a very, very painful knee joint, which in the end requires surgery to replace the joint. Another common cause of knee pain is tendonitis. In this picture, you can see the patella tendon, and if this patella tendon is inflamed, we call it patella tendonitis. This is a very common problem among those sports persons who jumps a lot, who runs a lot, and they will suffer from knee pain. And this kind of pain, the tendonitis or inflammation around the joint, is very, very treatable, and treatment will cure the problem. And you will not suffer for life if you have this problem. A bursa, paddings around the knee joint, and if these paddings, which allow smooth movement of your joint when you kneel, for example, is inflamed, you will have a condition called knee bursitis. If it happens at the top of the joint, you call it suprapatellar bursitis, and so on. One of the easiest way to treat bursitis is, if physiotherapy and medication fails, is to give injections to the bursa, and most of the time the pain will go away very, very fast. Another common cause of knee pain is a plica syndrome, which is caused by an extra bend in the joint, which cause clicking when you move the knee joint. If this become too much of a problem, causing too much pain, the best treatment is to just remove it using a camera surgery or arthroscopic surgery. Sports injuries are one of the commonest causes of knee pain, and most common problem caused by sports is tear of the ACL ligament. And for this problem, the only treatment for it, unfortunately, is undergoing surgery. And if surgery is not done to replace this ligament, the knee will go on to develop osteoarthritis, and finally the knee have to go for a knee replacement surgery. Meniscus tear also is one of a common cause of knee pain, which is very treatable. If the meniscus is repaired, the knee problem will go away and the patient is able to resume his sports activities after the meniscus has healed. That slide conclude my talk tonight about knee pain. I hope it is clear, and if it's not clear and you have any questions, we can entertain questions after this, and I will pass back the floor to Fazlin.
Right. Thank you, Dr. Izan, for the great sharing. I believe the questions earlier has been answered comprehensively. So now we go to Q&A questions session, right? Okay, we wait for our audience to post some questions here and we will choose it soon. Okay. Okay, doctor, we have one question here. If I do injection on my knee, do I need to inject every year for the rest of my life?
That is a very good question, common question, which is very important. It will depend on the severity of how bad is the problem. I have had patients who had been injected 10, 15 years ago, and I will see them 15 years later, and they say that, the injection I gave them 15 years ago has cured their problem permanently. So it will depend on what is the injection for. If the injection is given for a problem around the knee joint, not inside the knee joint, around like a patella tendon or bursitis, this will cure the problem, and you will enjoy life with your new knee without having to go for another injection again. But if the pain is caused by problem inside your knee joint, especially when it's caused by a cartilage problem, um, whether you need it to do it regularly or not will depend on the grade of the cartilage injury. If the grade is more than 2, most probably you will need to have a repeated injections. And if it's really big, if the cartilage problem is really bad, injection might not even uh, cause any relief at
Right.
all, and you have to go for surgery. So the answer to that question is that the need to do the injection every year will depend on the severity of the problem.
All right. Thank you, Dr. Izan. Okay, we have more questions here. From Azian Jalil. Assalam, doctor. How often I have to go for a jab? The best product in market. Hmm.
Um, okay. If your need, if you come for for knee pain and the doctor diagnose you with arthritis, for example, and the doctor have tried medications, have tried physiotherapy, and it fails, he will start you on an injection, and this injection will can last for a minimum of 6 months or 1 year. If
Hmm.
the injection fail to solve the problem, then you need surgery. If the injection cause you relief and you have good relief for years, then you don't have to go for another jab. So the next jab will depend on your pain. If you have pain in 1 year, you can have the injection at that time. You don't have to go for a regular injection if you don't have the pain. So, and this, um, the answer to this question will depend on a lot of factors, and for different patients, they will have a different response to the injection. Some patients, like my patient I mentioned just now, have a completely painless recovery for 15 years. Doesn't need any injection, and some don't even um, recover at all. Don't respond at all with one injection. So you don't know until you receive the treatment.
Okay, hope it helps, Azam Jalil. Okay, we still have questions, a lot of questions, Doctor. You open your clinic now, right? So, Mr. Izan, what's your advice for those above 35 years old and how they should take care of their knees? Any recommendations of supplement that they should take? Thank you from Shirin Xiao.
Okay, for those above 35 years old, on how to, okay, for any age, um, the best way to take care of your knees is to strengthen the muscles. I bet anyone who wants to take care of their knee probably need it because they are very active, like they want to run marathons or go hiking up the hill or mountains. So the best way to take care of your knee is to strengthen the muscle that is holding the knee, which is the thigh muscle or the quadriceps. This is a natural knee brace or knee protector that if you really take care of it, make it really strong, it can by right help to support your knee joint, to cushion the impact or prevent injuries to the cartilage. And that is the best advice I can give for anyone who wants to take care of their knee. For supplements, I would recommend supplements like for those who believe in nature-based medicines or supplements, any type of ginger or turmeric-based supplements can help because these supplements have anti-inflammatory properties, which can reduce the inflammation of your joint, reduce the inflammation of the synovium of the joint. Yeah, so supplements that contains turmeric or ginger or supplements like glucosamine actually is good on top of the muscle strengthening that you've done for your knee joint.
All right, Shirin, you can strengthen your muscle. Okay, right. So, do we have more? Yes, from Sefi. We have Sefi here. Doctor, if young guy, no knee pain, but always have cracking sound, does it mean he has high chances to have knee pain? Only the sound, doctor. Hmm.
Okay, this
But no pain.
sound can pardon?
Yeah,
No
no
pain,
pain.
just sound.
Yeah.
Okay, this is a very common problem. Can happen in the young or in the old. If it happens in the young, the old people will probably make fun of them because they are not old yet, but their knees are cracking, and this will make the young people angry, and they will come to me and ask this question. If it's not painful, it is quite normal, and you don't have to do anything. It can come from the plica, which I mentioned just now, rubbing against the joint. It can come from the tendons and the ligaments around the joint, which is stiff. So having a cracking sound in the knee actually is quite normal. It happens to a lot of people, but when it is not painful, you don't have to worry. You don't have to do anything other than to strengthen your thigh muscle. But if it starts to give you pain, then you need to investigate. The doctor will, you need to see a knee doctor, have it examined to make sure that you don't have plica syndrome, you don't have cartilage injuries, and the only way to diagnose this is by seeing a specialist.
Okay, thank you, Dr. Izan. We have more questions here from Pochin. Hi, Mr. Izan. I have knee pain for quite some time. Is it a must for me to do a surgery to recover?
It is not a must to do surgery. All knee pain will be should be treated using non-surgery treatment first. If all of those treatment fails and the knee pain become worse and worse with time, then an option is to do a surgery. It will depend on the cause of the pain. And most of the time, I will give the patient about 6 months of non-surgical treatment. If after 6 months there is no response or the pain become worse, then we show. Usually, I will do an MRI or an arthroscopy to know the exact problem caused by the pain. So, simply the answer is that it is not a must for you to do surgery if you have knee pain. Surgery is only done after non-surgical treatment has failed, and it will depend on the cause of the pain.
Okay, Pochin, see your doctor today or tomorrow, I mean, Okay, to know more about your knee pain, okay? All right, from Kok Chen Lau. Okay, doctor, can I go back to my favorite sport like jogging and badminton after the injection?
This is a very good question. Yes and no. If the doctor diagnose the pain as mild cartilage problem, you can go back to playing sports, but it is more advisable to play sports which are non-impact in nature. For example, cycling, swimming, brisk walking. If you are diagnosed with a cartilage problem, um, if it's mild after the injection, you can play. But if it's grade 3 and above, you have to probably treat it properly first. Probably have to go for surgery to really treat the cartilage problem before you decide to play sports again. So for those mild uh, conditions after the injection, they can play badminton again, but not for those with severe cartilage problem.
Right. Thank you, Dr. Izan. Okay, do we have more? Yes, from Ahmad Iqmal Ismail. Dr. Izan, is rowing good for my knees? I also play social badminton. I've been having knee pain and cracking sound as well. Okay, what exercise are good? Any recommendation, doctor?
Yes, rowing is good for your knee because it strengthens your quadriceps muscle, your thigh muscles. But if you have problem with your kneecap, meaning that the source of the pain comes from underneath your kneecap or your patella or the what we call a patellofemoral joint, then rowing will probably cause pain. So if that happens, then um, maybe rowing is not good for you. So you have to, in general, rowing is very good for your knee because it strengthens your muscles. But if that causes pain, it means that the problem must be coming from a place of your, from part of your knee that is involved during the rowing exercise. And if this causes pain, then you should seek treatment. And rowing is probably not a good choice of exercise. Play social badminton is good, provided that you need to prepare for the game. You need to do um, s- warm up, stretching, all those pre sports exercise first for at least half an hour before you play, because if you don't, your muscles and joints and tendons and ligaments will not be alerted and ready for the game, and you can injure your knee easily if you're not prepared for the game. You have been having knee pain and cracking sound. What exercises are good? I will always advise my patient to go for cross trainer exercise, cycling, and also rowing. If these three um, muscle strengthening exercises does not cause pain, then you should go on doing it. And after exercising for a good period of time, say for 3 months, and the knee pain has not will not are not gone, you need to seek advice from a doctor to know the reason for the pain.
Okay, thank you, Dr. Izan. Right. We just wait for a while. If we have, yes, from Kierman. Had a dashboard accident, total torn PCL and partial ACL. Had been cycling last 2 years without performing operation. Is that enough, doctor?
If the knee joint is stable, meaning is that it does not rotate or give way, then it's good enough. Surgery is only advised if the knee is not stable. It means that when you walk, especially on uneven surface, or as you go downstairs, you feel like the knee is giving way, or if it dislocate a little bit, then this should be a reason for surgery. If you do not feel that the knee is, if you feel that the knee is stable, then you don't need surgery. And cycling is a very good way to exercise the joint. Not don't go jogging. Cycling is good enough.
Okay, Clearman, stay cycling. Okay, right. Thank you, Dr. Izan. I think it's very full of input we had from you, apart from your presentations and also the questions from the floor. So we are going to end the session. But before we end Dr. Izan's session, I just would like to make an announcement. I mean, a good news for the audience tonight. Um, if you would like to have discounts for knee consultation with Dr. Izan, you can contact CMAT customer service. Okay, get this number, very important, right? Okay, whoever has planned, okay, after this to see Dr. Izan in Al Islam Specialist. So you can contact this number 010-831-9863. Okay, I repeat 010-831-9863 for more information. Right? Okay, thank you, Dr. Izan, for your sharing. Thank you for
Thank
being
you
with
very
us
much.
tonight.
Thank you very much for having me tonight.
right. Thank you, audience, for stay with us until almost end because we have a very special event for you because you stay with us. We have 48 viewers now. Okay, become more. So what you need to do for this lucky draw is you need to put in keyword active join now. There will be 5 lucky winners will be entitled gift worth 139 ringgit. So shall we start now? Put in keyword active join. Just type in active join now. There will be 5 lucky winners tonight. We only have 1 minute. Who are the lucky ones? The luckiest one. 5 of you. Right, active join. Active join. From Nurin Hamza. From Lo. From Rodden, active join. All the best to you. We'll see who is the winner tonight. The winners will get supplements and also the knee wrap as well. So just blast your active join in the comment below. More chances for you if you just keep typing. Who knows? The supplement, the necessary supplement for you, and also the knee wrap. You can share with your friends, family members. We only have 20 seconds. Just keep trying. Oh, we end because the music ends. So usually that's a sign of finding something. Okay, music continues. This is how you have chance. Active join, active join. Five winners tonight. Okay, we actually have the winner. We will announce soon. Right, so there'll be a banner, okay, a poster to share to you who are the lucky winners. So if you see your name, please snapshot, screenshot your name. Just wait for a while. Three lucky winners will get the supplement, while the other two will get the new wrap. We're waiting for the banners to come out. Thank you for participating. Oh, we have the winners now. We have Shirin, Pochin, Safi, Wong Yip Moon, and Nurin Hamza. Please screenshot this to claim your gift, your lucky draw gift. And you can use Messenger, okay, and show us this screenshot. You can use our Facebook messengers to claim it because we need your detail to send it to you. All right, then congrats winners. Shirin, Pochin, Safi, Wong Yip, and Nurin Hamza. Alhamdulillah, Nurin Hamza. Yeah, congrats to all. Thank you for watching us tonight, and stay tuned for our page for the next live session. Have a very good weekend to everyone. Bye.